Among other things, September recognizes Pain Awareness Month. So we're going to dive into it this month and talk about chronic pain conditions. Conditions that have chronic pain as one of their symptoms um, kind of overlap. There's a lot of ambiguity and I think still a lot of confusion around them. I do know that conditions with pain, whether it's just like a nerve condition or whether it's something more like MS or MD, those kind of conditions do come with more comorbidities, which means that if you get one of them, you're probably going to get another one. It's a long, difficult, painful road, literally, for anybody going through this. I have only received a diagnosis of fibromyalgia, um, but I do suspect I have some other things going on in my body that are masked by the fibromyalgia, such as I'm pretty convinced there's some widespread issue with my muscles. They're tight all the time, and no amount of massage or treatment seem to loosen them on a permanent basis. I might get some relief for that day, but that's it. So, fibromyalgia is a chronic condition, which means it's going on all the time, that's characterized by widespread musculoskeletal pain and fatigue and nerve pain and a bunch of other symptoms. People with fibromyalgia have a really difficult time with sleep. They tend to have some sort of gastrointestinal thing that's connected to it. Um, Widespread fatigue, brain fog, and cognitive as I try to saying that cognitive difficulties with things like memory. Um, it's enough to make one feel that they're losing their fucking mind. In my case with fibromyalgia, the cause is unknown to the medical community, but I have a therapist that told me that it's stress. I think the medical community is starting to come around, but my body has lived in fight or flight its whole life, and it can't really distinguish anymore if I'm in danger or not. So it's always telling me I'm in danger. Fun, huh? Treatments for fibromyalgia include medicine, or pharmaceuticals, I should say. It includes encouragement to move your body and exercise. Um, Physical therapy is effective for some people, what didn't prove to be effective for me. Cognitive behavioral therapy, which is like a mental counseling, but it helps you learn to deal with the pain, and lifestyle modifications such as improving your sleep patterns and managing stress. I take medications. I get in-person treatments like acupuncture and massage, um, and I try to move, although that's been a little difficult with bad ankles and bad knees. But I'm moving more than I was, and I have a referral to speak to a cognitive behavioral specialist, but have been trying to get a couple of other providers dealt with so I could move forward with that. So, fibromyalgia is more common in women. Typical onset comes sometime between 30 and 50 years. That's 20 years. That's a really, really big range. So just think about all the women you encounter every day, and in the ages of 20 or 30 to 50, there are a ton of them that are having this condition happen. There's not a single diagnostic test. It's a disease that, or a diagnosis of exclusion. I think I've talked about that a little before. Um, and yeah, it coexists with other things. So it can really be just defeating. The worst part of fibromyalgia for me is the loneliness. It's an incredibly um, disheartening experience to have people that you love that just can't understand where you're at. And so it sometimes feels like there's not a lot of support there. And I think it mostly boils down to communication. And people with fibromyalgia have to learn to identify their needs and to ask for help when there's help, something available. A study done in 2023 suggests that 25% of women um, suffer from some sort of chronic pain condition. So this month we'll be diving into some of the other conditions. I will be doing my best to learn what I can about them, as that'll help me understand how to best hold space for people in our community. And I would be most honored to receive stories of your own experiences that you have with chronic pain, um, as well as the things that don't work and the things that do work. As we build a community, this kind of input from the people in the community are going to be the things that will attract more people to join our community. If we have resources, if we have connections for them, if we're already talking about what we're experiencing, it'll make our community feel like a safe, welcoming place for others. So we'd love to hear your stories.